Hello, my name is Vivian NWAKAH, founder of Medsaf. Medsaf is a medication supply chain management solution for African hospitals and pharmacies. So I grew up in the United States. I was born and raised there and worked in healthcare. My first startup was working for a home healthcare agency, and we were able to grow from 1 to 4 in Illinois and Indiana. And so that was my experience with the healthcare industry, and I really just thought, maybe I should just go to business school, get a little bit of a different perspective, and come back to Chicago and push the home health cares in a different way. And so that was my thought. I love to travel, so I said, okay, well, I'd like to do a business program where I can travel too. And so I found a program where I got to study at IAE de Sorbonne in Paris, the Federal University of Rio in Brazil, and Georgia State's J. Mac Robinson Business School. So got to travel around, these various locations and do stops in China and other South American and Asian countries. And so now I'm kind of traveling the world and thinking about things from a business perspective and seeing a lot more massive problems in emerging markets that could be solved if you kind of take what works well in a developed market like the United States and can match it to solve the issues. And so I decided to do an internship in Lagos. It was only supposed to be 3 months, and I was supposed to then return back to the United States. And I had never been in sub-Saharan Africa before. But my parents left Nigeria in the 1970s. So I chose Nigeria specifically so I could also get close to my roots and find out, what is this about Nigerian people, And so I went to Lagos, and my eyes were just opened by all of the various issues that I faced, whether it was, power or infrastructure or education. I just saw, ways of disruption everywhere. And I saw technology being a main force of disrupting the way of life. And I thought that was very inspirational to me. In the second month that I was in Lagos, a friend of mine died from taking a fake malaria pill. And so that is what kind of woke me up to the fact that healthcare, is a massive problem. And there are so many aspects of healthcare that need attention. And, I have this healthcare background in the U.S., and I thought I could do something here. So I actually ended up staying in Lagos, and, the journey led me to start Medsaf. And so what we realized is that pharmaceutical products that enter the country, there's a lot of various reasons why it's a very disjointed and kind of chaotic system. Medications change hands many times. 70% of all medications are imported into the country. So you've got tons of issues, whether it be regulatory issues or just issues of moving throughout the country, getting medications to various stakeholders. And I looked at the chain. I looked at the manufacturers, and I looked at pharmacies and hospitals and patients, and I said, who has one of the biggest pain points? And what I realized is that, a lot of money is put around manufacturing, but that in the supply chain, they were ignoring the hospitals and pharmacies. That the hospitals and pharmacies needed support. 75% of all hospitals and pharmacies in Nigeria are owned by a single owner, maybe a family, a doctor, a nurse, or somebody, and they needed support. And so they're tasked with coming up with their whole procurement program themselves. And they have to work with so many various suppliers, and you're only as good as your network and your ability to manage that process. So I saw that technology was really disrupting a lot of industries, and I said, well, why not put technology towards making drug distribution within the country transparent, seamless, efficient, and cost-effective, which would improve quality medication. And so that's how Medsaf came to be. So we started in January of 2017. Since then, we've been working with about 70 to 80 hospitals or pharmacies across Lagos specifically. We've been able to raise about $1.4 million, and we've been able to really assemble a great team of individuals to kind of help tackle this problem. And I think the impact is so big for our hospitals. We've been able to become the major supplier for many of the hospitals that we work with, and we've seen them be able to grow and expand and start to take quality seriously, to really kind of work with us to try to improve the working relationship with Medsaf, and that's been really inspirational. Because we were just kind of thinking outside of the box of how to solve some of these hard challenges, we've done things like be the first medication distributor distributor to create a financial product around purchasing medication. So we're now helping hospitals access working capital, so that they can make better decisions about purchasing medications. We're funneling resources to our hospitals. And so we kind of really see this big opportunity to just be this platform where hospitals can purchase and manage their medications, and we can scale that concept across Africa.